was talking about preventative medicine, I mentioned labs. And if you didn't know, we do draw labs at our Two Roads locations. So if you're our patient, you can get your labs drawn there. If you're not our patient, you can still have your labs drawn there and we can draw them for you. So we try to offer that service to people in our area so they don't have to drive as far. But labs are an important part of preventative medicine. The blood tells us so many details about what's going on inside the body. So when we're looking at preventative medicine and the lab checks that we're doing annually, we're looking at things like your A1C to assess for diabetes. We're looking at cholesterol levels to see your risk for heart attack and stroke. We're checking your CBC to look for things like anemia, infection. We're checking electrolytes. I check vitamin D, B12. I look at hormones. Different providers have different things that they check. But based on what you're going through or the symptoms you're experiencing, we can kind of alter that. But those are some of the basic ones that we cover. And I know when we're looking at these labs, it can be kind of overwhelming for people who don't look at them all the time. And we see things on there that may show up red that seem concerning to us. As a provider, we know what that means, but the patient doesn't always know what that means. So ask questions, find a provider you can have a discussion with about what's going on with your health. Because just because something's red doesn't really mean that it's concerning. Those levels can be barely out of range and it will flag high or low. So to us, that says something different than it may say to the patient. So make sure that you find a provider who is explaining these things to you in detail and allowing you to ask questions so that you can understand what's going on with your body.